Minimally invasive surgery is a term that refers to a collection of procedures designed to reduce the impact of surgery on a patient. So very often that means doing major surgery, but through smaller incisions or in a less invasive manner. So there's multiple types of minimally invasive surgery, ranging anywhere from a scope procedure, and this we will commonly do in the office, for example. Other forms of minimally invasive surgery are typically called laparoscopic surgery, and there's other forms as well in different specialties. But with laparoscopic surgery, we put a scope into the belly, into the abdomen. We insufflate the belly, which means fill it with gas, and in doing that we can move the organs around. Once we do that, we have a lot of working space to do all the things that we might need to do. The benefits of minimally invasive surgery are significant. The standard outcomes that are used are number of days in the hospital, length of recovery, amount of pain that a patient would have, amount of blood loss. And laparoscopic surgery, when compared to standard surgery, reduces all of these difficulties. So traditionally for a kidney surgery, where we would make a larger incision across the patient's side or across their abdomen, and might require 4 to 6 weeks of recovery, with a laparoscopic approach, often a week or 2 is all that's needed. So robotic surgery is an extension of laparoscopic surgery. The surgical robot, and the one that is most commonly used is the Da Vinci robot, harnesses this standard equipment and instrumentation, but then does a couple important things beyond standard laparoscopy. So robotic surgery, you get a 3-dimensional view rather than a traditional 2-dimensional view like your TV screen would have. It also provides greater magnification so that you can see clearer the operative field. The other significant advantage of robotic surgery is the instrumentation. So with standard laparoscopy, or sometimes called straight stick surgery, all of the instruments are straight and are not articulated or wristed. With the robot, all of the instruments are wristed, and that really enables us to make some fine maneuvers and to do so in small working spaces. So the surgical robot is of particular benefit for the more advanced procedures. So when suturing is required, when real precise reconstruction of organs is required, then it really provides even more benefit. It's helpful for pretty much any laparoscopic procedure, but for the more challenging procedures, it really adds significant value. So in my hands, I greatly prefer the robot for example, prostatectomy, which is the removal of the prostate for prostate cancer. The robot, again, with the magnified vision, helps us to see very clearly where the prostate is and where the nearby structures are. I can tease away the nearby structures, so for prostate cancer, often that's some nerves that are nearby. And then it also helps when we are sewing things back together. So when we're putting the pieces back together, it allows for a very precise reconstruction. As Director of Robotic Surgery at Spectrum Health Medical Group, I had the privilege of working with a great bunch of surgeons. There are surgeons in multiple specialties who have expertise using the robot in their field. At Spectrum, we're privileged to have cardiothoracic surgery, colorectal surgery, gynecologic surgery, general surgery, and urologic surgery performed using the robot. We're one of the few centers in the state and in the country that have this breadth of experience and expertise.